So I want to talk today a little bit about faking it till you make it. And I think there's two ends of the spectrum here. There's faking it till you make it in that you don't know a dang thing about what you're doing, and you better get that knowledge before you go in there and you treat that patient. And there's certain conditions, there's certain environments, there's certain settings that please do not fake it till you make it. But then there is the other side of the spectrum where you just feel scared and you don't know if you are adequate enough. And I want you to know that you do belong at this table. You do have a place in our field and in your facility. And sometimes just having, that confidence that you can help this patient. But you've got to get the knowledge. You have to have the knowledge. You have to be competent. That's one of our code of ethics in ASHA is being competent before treating that patient. So I want to talk a little bit about, kind of my journey. And I worked all by myself. I was the only SLP in a SNF, and I just felt like I was out on Dysphagia Island. I know we keep talking about that, but I was bound and determined to get myself up to be the SLP that I knew that I could be and get my patients the outcomes that I knew that they deserved. So I really just went on this 2-year crusade of taking every ASHA CU course possible. And it was amazing, but it was also totally draining. And I say that because there were so many courses that I took that really didn't even apply to my setting. I just thought they were the latest and greatest and thought I should take them. So I did, and come to find out they didn't even work for my setting, or I may have 1 or 2 patients over the course of the year that this specific technique would work for. And I don't regret that because it definitely set me out on this journey that I wanted to acquire as much knowledge as I could about this field. But on the other hand, like I said, it was draining. I was spending so much time away from my family, invested in my career, and learning all these things that really didn't pertain to the setting I was interested in the most. So this was something that I really set out to create. Is I knew that there had to be an easier way of acquiring the knowledge that we need to do our job and doing it in a supportive environment. So that's why I created the MedSLP Collective, because we have resources for all different conditions, for all different topic areas, for all different treatment techniques, for all different settings. And I think that's what's so important, because I might be interested in learning something about the ICU, but if I'm working in home health, I don't want to say it's a waste of my time, but it might be a waste of my time. So I wanted to create this resource library to give you a place that is a starting point. So maybe you can learn a little bit more about a topic and then say, oh, you know what? I really do want to become an expert in this. I am going to go spend my time and my money on taking this ASHA CU course. Or, I don't know, the more I learn about this, the more I read about this really doesn't pertain to my setting. So I think that's why I created this, and that's why I created it, because I want to make things a little easier for you. We're all working really long hours. We're working a stressful job. And it doesn't need to be even more stressful than it already is. So I don't want you to fake it till you make it when it comes to the knowledge base and being competent in treating our patients. I do want you to fake it till you make it in knowing that you can do this. You can learn the knowledge you need. You can do it in a supportive environment. You can have access to mentors that will help guide you, that will help you decide what courses to take, what setting to work in. So that's when it's okay to fake it till you make it. But until then, I would love for you to join the MedSLP Collective, where we've got an entire resource library of all different topics across aphasia, dysphagia, dysarthria, voice, cognitive communication, as well as an entire team of mentors to help you with these clinical cases, to help you navigate some of these situations in our facilities that you did learn in grad school. Hi, my name is Theresa Richard. I'm a board certified specialist in swallowing and swallowing disorders. I am the creator of the Swallow Your Pride podcast. I am the owner of a mobile fees company, Mobile Dysphagia Diagnostics in New York, and I am the founder of the MedSLP Collective. Thanks for watching.